I'm Simon Smale. I'm a gastroenterologist based in York. Welcome to More Than Just Medicine. I thought today I'd talk a bit about the diagnosis of irritable bowel syndrome, the grounds on which that diagnosis is made, and appropriate investigation to confirm that diagnosis and rule out other conditions. So, first of all, what symptoms do people with irritable bowel syndrome present with? Well, the National Institute for Clinical Excellence in the UK suggests that people with irritable bowel syndrome should have at least 6 months of abdominal pain, bloating, or change in bowel habit, and that may be constipation or diarrhea, or alternating between the two. Obviously, those are common symptoms, and they may well reflect other diseases as well. So, we need to think about other bits of the history, other parts of the story that may give a clue as to other conditions. Things to look out for in terms of things that indicate that this may not be irritable bowel syndrome include a history of unintentional weight loss, which always, whatever age people are, raises alarm bells that there may be something more going on. Secondly, a history of rectal bleeding. Although rectal bleeding is really common and often not something sinister at all, it's not a normal feature of irritable bowel syndrome, and therefore someone with rectal bleeding needs some further investigation. Again, people who have a strong family history of ovarian or bowel cancer need a little more thought applied to whether their symptoms really are reflective of irritable bowel rather than of more worrisome conditions, obviously ovarian bowel cancer being predominant amongst those. And lastly, patients who are more mature, certainly those over 60, who present with relatively new symptoms, so perhaps less than 3 months, should be considered for further investigation because they may have more worrisome disease. There are obviously one or two other diseases that may present similarly, and therefore it's important that we rule out those diseases. So common diseases which may give a story similar to irritable bowel syndrome include inflammatory bowel disease, celiac disease, and occasionally a thing called pancreatic insufficiency, but often people with that present with weight loss. So people should also, as well as having their doctor listen to their story, have an examination. So it's reasonable for the doctor to have a feel of your tummy and look for signs of anemia. Again, that's not a feature of irritable bowel syndrome. For any obvious abdominal masses, because people with irritable bowel syndrome shouldn't have abdominal masses and lumps and bumps in their tummy that you can feel. That's not a feature of irritable bowel syndrome, and nor should they have any rectal masses on examination of the bottom of the anal canal and the rectum. Having taken a history and examination, there are some other blood tests and other investigations that perhaps ought to be considered. So the National Institute for Clinical Excellence guidance suggests that we should have a full blood count, a normal use and ease, liver function test. Now, full blood count is a test that looks for anemia, but it also sometimes shows a raised what's called white cell count, and the white cells are the cells that coordinate our immune system. They're often raised in inflammatory conditions. So if they're raised, that's sometimes a clue as to other things going on. Similarly, platelets are the component of the blood that helps stick your blood together when you cut yourself or when you're injured. But they're often raised in inflammatory conditions as well, particularly Crohn's disease of the bowel, which if the platelets are raised, obviously that raises other questions about whether further investigation is necessary. So people should have a normal full blood count, normal use and ease, and liver function tests. And they should also have negative CRP, so a normal C-reactive protein, or ESR. Now, CRP and ESR are both tests of inflammation. They're slightly different tests. A C-reactive protein is a protein made in the liver in response to inflammation in the body, and an ESR is a measure of how thick the blood is. And often, if people are unwell because of the body's inflammatory response to being unwell, the blood becomes rather thicker, so the ESR goes up. Now, there is a condition called celiac disease, which is an allergy to wheat, which damages the lining of the small bowel, and people should have a blood test to make sure they don't have celiac disease. These days, although it's not in the National Institute for Clinical Excellence guidance, many people would advocate that people should have a stool test called a fecal calprotectin to make sure that that is normal and to rule out inflammatory bowel disease, although often people with inflammatory bowel disease have abnormal blood tests and CRP and ESR and full blood count. Furthermore, if people have got features suggestive of pancreatitis, so the pain is perhaps more in the upper abdomen, or they have any weight loss, or what's called steatorrhea, where the stools don't flush away easily and are rather fatty, particularly after fatty meals, then I think it would be reasonable for the doctors to consider a test of pancreatic function. Now, that's sometimes a stool test, sometimes that's done in other ways in other institutions. Now, that's the investigation. So, in terms of the history and the examination, one would expect, as I've said, those features of abdominal pain, bloating, or change of bowel habit for more than 6 months. No red flags. Obviously, those are the features that suggest more worrisome conditions in terms of weight loss and malignancy. And lastly, normal investigations. And if the history is suggestive of irritable bowel syndrome and examination is normal and those tests are normal, we can be confident that that is the diagnosis. I'll talk in further videos about who gets irritable bowel syndrome and why they get it, and about some of the treatment options. Thanks for listening.